While many Montanans eagerly anticipate winter each year, the gray skies and cooler temperatures that come with the change of seasons can also wreak havoc on others. Tonight, Q2's Jenny Fick takes a closer look at seasonal affective disorder.
If you find yourself feeling off during the change of the seasons, you are not alone. St. Vincent Healthcare's Dr. Erica explained the science behind these feelings.
The winter blues may be just kind of a mild form of it, where seasonal affective disorder is more of a clinical term for a type of depression that has a seasonal reoccurrence.
Symptoms of seasonal affective disorder can include overtiredness, feelings of sadness, and overeating.
Not interested in doing the normal activities that they used to like to do, maybe during other seasons.
The change of the seasons can be confusing for our internal clock.
Our bodies are regulated by the light and the dark, and in these winter months when it gets dark so much, and people who do have seasonal affective disorder or winter blues are found to have a little bit being overproducers of melatonin, which is a hormone produced by our brain that is secreted when the lights go down to make us feel tired, to help us sleep through the night.
So, what can you do?
Light therapy has been shown to decrease the severity or the incidence of seasonal affective disorders.
These light boxes put off therapeutic light, and studies have found them to be effective if they emit an intensity of at least 10,000 lux.
For 15 or 20 minutes in the morning, if they need to take it to work with them and do it again kind of in the late afternoon, then that can be helpful for people. We advise them not to use the light later in the day or around dinner time because it can be strong enough that they may have then a hard time going to sleep later at night. So you want to let your brain do its normal circadian rhythm and melatonin secretion toward the evening hours.
Based on the severity of the disorder, different steps can be taken, from higher intake of vitamin D to medication during the months where depression occurs.
Can just feel kind of icky outside, and that's where maybe getting the light, maybe taking some extra vitamin D in the winter would be something that you can do. But some people can be really severely affected by this seasonal affective disorder from a depression standpoint, where they're really withdrawing from society. Some people may even, at some extreme, have suicidal tendencies because they get so down and so sad. And so it's very serious. And I would encourage people to talk to their friends, talk to their family, talk to their medical provider, because there are a lot of things we can do.
Dr. Erica says that being aware of the disorder is part of the solution. She also recommends that if you can, take a vacation somewhere sunny and warm. Doctor's orders. In Billings, Jenny Fick, MTN News.
Great advice. Thanks, Jenny. Well, Dr. Erica says light therapy can be purchased online and at health supply locations, as well as at www.alaskanorthernlights.com. Jay.